Good afternoon, Dr. Gary here on the road. We are dental practice brokers nationwide. We sell dental practices. So today's topic is how certain untraditional banks can view a buyer's ability differently to afford paying for a dental practice and qualifying. We'll get into that. So we're now in 28 states. We have 10 employees. We've been dental practice brokers for 13 years. I was a dentist for 25. And you can reach us at 201-663-0935. Our website is dentalpracticeguide.com or nationwidedentalpracticebrokers.com. So call us, you can reach us, and be happy to talk to you. All the information you're hearing today is our opinions and is for entertainment. We can also answer the phone, as they say, from 8 a.m. to 9 p.m. at 363 days a year, taking off Christmas and Easter. That will be at 8 a.m. East Coast time, 9 p.m. East Coast time. So we answer the phone essentially every day. So call us. We'll get on top of it. All right? Now, if you're thinking about selling to DSO, remember, we work with them all the time. We selectively choose the right ones. We don't have a strategic partner, but we could bring them in, and they'll often pay our commission. And when you work with us, I can get your legal fees based on certain criteria paid, reimbursed at closing. So call us about that program. We've done that several times based on certain criteria, but we can help you with that. So now getting back to this issue for today, how certain banks, non-traditional banks, or money brokers you can call them, know how to qualify a buyer for a loan, a certain loan amount, whereas the traditional bank may not do that. We have an instance right now where a traditional bank is not financing the loan completely. Seller wants a higher number, buyers at a lower number, and banks not making up the difference. Okay? I think the seller is at 77, 78%. A little higher than the buyer wanted, but the buyer would maybe negotiate. But when I talked to a non-traditional bank, they said, well, let's analyze the buyer's ability to produce, because when banks analyze or review a buyer, they're looking at credit score, past history, late pays, and so forth, in the credit report. They also should be looking at the buyer's ability to produce dentistry, okay? Because a buyer can be working for another dentist, producing a lot, but collecting a lower amount because of the write-offs of the PPO insurances. But if that buyer, now I have one non-traditional bank that will analyze the buyer's ability to produce rather than just looking at their tax return, because don't forget, the buyer's working for a PPO fees, so a lot of their efforts are reduced by 20, 30%. But if that buyer works on private patients, their yield will be a lot higher because there is no discount. So I work with certain non-traditional banks who see the value in a doctor and the doctor's productivity by analyzing, let's say, for example, are they getting the big cases, or is the main doctor taking all the cases? Therefore, their productivity is low. Then maybe we'll analyze the buyer's productivity when the seller's out of the office, maybe for a 2-week vacation, and the buyer's taking over everything. Suddenly, you could see the buyer's productivity increase remarkably. And certain banks will analyze this and understand this. Others will only take an average, and they can't get their arm around it. So this is important. We go to different sources for you to get the loan approved. And we've been doing this for a long time. Lately, I've been working with one money broker. Again, we don't really want to share that. You can call us, I'll tell you privately. But that has flexibility and essentially can make things legitimately happen. All right? So there's information out there to help you. I can help you. Give us a call, and we'll get you rolling. Our number is 201-663-0935. Please call us. We can go over everything. Thank you.